So my name is Juliette. I am a medicine student, as Masoud already explained. So I am still in school, so I probably have about 0 credentials, but I do have something very interesting to talk about, which is the project that I made with Masoud, the People's School of Reproductive Health, PREhealth for short. And I want to explain to you a little bit what it is exactly, why we made this platform, how we approach fixing these issues that we're seeing, and a little bit at the end where we might ask for your help. I hope if I do this. Yes, great. Oh.
Your mic is...
Oh.
That's better.
Great, thank you. Okay, so what is PREhealth? As Masoud explained, we wanted to create some sort of platform to increase health literacy, and especially reproductive health literacy. And so we publish on this platform reproductive health related content, and we focus mainly on preconception, pre-implantation, and prenatal information. And we cover topics including prenatal testing, which is kind of where it all started, and I will explain this in a little bit. Fetal and parental disease during pregnancy, and features of pregnancy, such as, what happens, what can you expect during pregnancy, what are some things that you can do to take care of yourself. And we developed this platform to especially cater to these 3 audiences. The first of all is people with low literacy, so people who don't have the basic tools to understand written material. People who don't speak English or Dutch, so any other language, and sexual, gender, and ethnic minorities, because these populations are traditionally underserved within this reproductive health kind of literature. So I want to first start with explaining kind of how we came about, and we start at our conception, which was in November 2021, because as Masoud explained, this platform was created within the context of the honors program, and so we started with a program in 2020, about October 2020, and we were doing some research on NIPT. What exactly we did isn't really important for this talk, but during this year, we established that it seemed that there were a lot of people who weren't aware of the options that they had during the pregnancy, and several tests that they could undergo, what they could expect, etc. And so Masoud had the initiative to create some sort of platform to inform these people and have a central place where all of this information was collected in many different ways, so that it was accessible to most people, the largest amount of people. So yeah, we started with this in November 2021. And so during our little gestation that we had, we wrote some articles, we came up with some creative ways to educate people. And then in March 2022, we had our birth, because this was the end of our honors cohort. And so we gave a little presentation, explained what we did, we published a website, and so from then on, we did decide that we wanted to continue with this program because we really did see potential in this to make changes. And so we discussed, where do we want to go? Where do we want to be? What do we want to be? And so now we're in the future, which is now. And I will explain a little bit, as I said, why we saw the need. I already explained, right, that we saw that people weren't really sure what different options that they had, and I'm taking the NIPT as a case study. I was told there may be some people from Trident in the audience, so I sure hope that my data is correct. So from Trident 2, it was shown that about 40% of people eligible for NIPT actually chose to undergo NIPT. But this percentage was a lot lower in disadvantaged neighborhood, about 20% uptake instead of 40%, especially if these people were also religious. And about 33% of everyone who didn't elect to undergo NIPT has actually too little knowledge to make an informed decision about whether to undergo NIPT or not. And this, we really do want to help close this knowledge gap, because we do want everyone to make, whether they choose to undergo it or not, to have that decision be an informed decision. And we see that many people simply don't know enough to make that decision. We also see that a lot of people struggle with low literacy. So here in the Netherlands, about nearly 1/5 of Dutch citizens aged 16 and up have low literacy, meaning again that they don't have the basic tools to comprehend written material adequately. And this is, as you might expect, most common in people with least education. And our percentage is increasing because we have an aging population, but also because primary school education the quality of that is deteriorating a little bit. So upon graduation from primary school, people are able to, like their reading levels are lower. And also refugee literacy levels are a little bit lower than in the general population here in the Netherlands, because of, if you're from an unstable region, there's less focus on reading. And so this can have an impact on health. If you're not understanding what you're reading, you don't know, what is best for you. And so this is also, so I talked about the Netherlands, but it's in general in the EU, it's also about 1/5 of adults who have low literacy. And so we help to bring high quality reproductive health education to this group. And we do that in different forms that I will explain a little bit later on. And lastly, we believe it's needed because of a lack of diversity and inclusivity within reproductive health. So, if you Google pregnant, the stereotypical kind of image that you have of a pregnant person is a straight-sized, heterosexual, cisgendered white woman. But there's obviously so many more people who fall outside the boundaries of this very small kind of box. And these people have not really been included in a lot of reproductive health information and research as well. So, for example, right, we see that in the US, it's a very large problem that for Black women, the maternal mortality rate is much higher than for other women. And we see that here in the Netherlands, refugees and low-salaried labor workers, they have much worse health outcomes, including reproductive health outcomes, compared to the general population. We see that patients of several different minorities are discriminated against within healthcare. And we also see that, for example, for queer women, their health outcomes are also worse than for heterosexual women. And so what we try to do is create an inclusive environment for learning so that we help increase awareness and increase health outcomes among marginalized groups. How do we do that? The first is awareness is fairness, right? If you know what you can do, that is much fairer. You have a much higher likelihood of a fair outcome than if there's one group who doesn't know what they can choose and doesn't know how they can really make the best choices within their pregnancy. So we aim to, you can see here a screenshot from our website. We aim to publish this information to make it very easily accessible to people. And we have several different categories. The main one of which is tests, so that we cover prenatal testing, preconception testing, all of these things, and make it really simple, explain in a really simple way so that it's accessible to a lot of people, but also maternal complications, fetal complications, different health tips, etc. And so we also try to cater, as I said, to different levels of health literacy. And one of our largest ways to do that is to have a very large and inclusive glossary. So in an article, we want to go in depth in our articles because there's also a lot of people who want to know a lot about the topic that they're reading about. But if they're not understanding some of these words, they can look them up in our glossary. And we also, if you're not able to read very well, you want to have different options, right? So we started with making videos of each and every article that we have. We have 2 at the moment, but we have more articles, but they're on their way. But we have more ways that I'll touch on in a bit, that we try to make this information available for many people. And then our last way is to focus on diversity and inclusivity, because, for example, right, our team, this is really important to us that our team is also from different backgrounds, because you cannot focus on diversity and inclusivity if you have a team of 7 people that look like me and identify like me. So we need different people who come from different places and are from different cultures to really create this inclusive environment. And so one of our largest focus is on imagery, because you know, a lot of times marginalized groups are kind of an afterthought in imagery, right? You can, if you go to some website, for some people there may not be a lot of people that look like them, and if you cannot relate to what you're seeing on the screen and what you're reading on the screen, you're much less likely to apply it to yourself. And so that is, we want these marginalized groups of people to be the focus of what we do and not just an afterthought of what we do. We have these different languages available on the website. We have these for now, but we do aim to expand vastly into many different languages, but of course we need people for that. And then we have some more abstract kind of ways to shape this information. I'm not going to go into all of these, but if you do have any questions about them, feel free to ask. And then lastly, we also think it's really important to have a place for people to come to us and say, hey, you know, I read this on your website, or I saw this on your website, and I actually don't think that this is the right way to go about it, or maybe there's a different way to go about it. So we do invite them to contact us and make their opinions heard with us. And lastly, I want to touch on our peer review process. So we have an editorial standard you can see here. And this editorial standard includes a peer review graphic, which you can see here. So basically, when someone writes an article, two of our team members go in and review it, and then they send it to the editor, which is me. I go through it again. I see, you know, what can we do better? Are we consistent in how we're presenting our information? And then what we want to do is send it to experts for review, so that so that we can have high medical accuracy as well. But for this, we need experts, obviously. And what do you know? There's a whole room full of experts right here. So what we really want to do is have these experts review. Your name would be right there. So what we're looking for is scientists in the field, but also medical doctors, specialized nurses, midwives, to go through this content and review it and give your feedback to us. And if you want to know what's in stock for PREhealth, or what we think is in stock for PREhealth in the future, we also want to set up a focus group so that we're sure that what we're trying to do, that's something that we're actually doing. So we want people from our target audiences to also go to the website, see if they can understand everything, see if it's accessible to them. And then we also submitted for a grant, which the results of which will be out on December 1st, so that's exciting. We need more hands, we need more volunteers to make these different ways to give this information to people, such as infographics, videos, all of that. And then we want to create an audio version of each article, because we've talked a lot about looking and reading, but obviously there's also people who can't do all of that. So we want to be able for people to listen to our content as well. We want to increase the number of languages that we have, further translate content that's already in, and then further increase accessibility for disabled users, because at the moment we only really focus on contrast on the website, right, like visual contrast. But there's so many more ways that we can go about increasing accessibility in that way. So we want to explore that. For that, again, we need hands and money as well. So, yeah. So if you heard all of this and you thought that's an interesting project and I might want to help with that, I might want to help, you know, inform more vulnerable populations to increase reproductive health literacy, you can send an email to any of these email addresses. You can go to our website and go to the contact form and send a message there, or you can scan the QR code, which will also bring you to the website. Yeah, and we will be very, very, very glad to receive a message from you. You can also come up to us, you know, if you have more questions or want to give us your information so we can contact you. Yeah, we'd also like to thank Maastricht University and the Faculty of Health, Medicine and Life Sciences, because they really are enthusiastic about this project as well. And they facilitated the start of it and they support it for the future. Yeah, so that was that. Thank you.